Hello everyone, my name is Kevin. Today is March 23rd, Monday. I want to talk about do we need to wear a mask and how to choose a proper mask in this COVID-19 epidemic in Canada. If we ask this question in January or in February, I think we don't need to wear a mask at that time for daily activities. But in March, I do believe we now need to wear masks, and every home should have some stock of masks. The reason is when you go out for grocery, we try to stay home as much as possible. Don't go out for unnecessary activities. But if we have to go out to buy groceries, or someone cannot stay home, they have to go out for a walk. So at that situation, you need to wear a mask. Why? Because a lot of mild cases, people get infected, but they have very mild symptoms. They either don't pay attention or they don't care, because usually they are young people and they can be around you when you buy grocery, right? If they don't wear mask, you don't wear mask, you have a very high risk of infection. If you wear mask and do hand hygiene, you reduce the risk by a lot. If both of you wear a mask, then the risk will be really even minimized. So when you go out, today in March in Canada, you need to wear a mask, especially you go to indoors. And if at home, if everyone is healthy, so you don't need to wear a mask. But if someone is sick, no matter it's the new coronavirus or it's just you think it's common cold, that patient is still needs wear a mask to protect the other family member. So what kind of mask we should wear? And for masks, I think there are two factors to consider to determine the level of protection. So one is the water resistance. So the higher resistance, the better. And the other one is the ability to filter the bacteria and the virus. So the top level is N95 for medical professionals, healthcare professionals. That has the highest water resistance ability, and it can filter 99.9% of bacteria and virus. Because the doctors and nurses and other professionals, they work very close with the patient, and they have a very high risk, so that they need the top protection. For general population, general public, we don't need N95 because it's very expensive and it's really short of supply. Hospitals urgently needs N95 masks, and also if you wear the N95 for a few hours, you'll feel suffocated. It's hard to breathe. So for general population, we just need to wear medical masks or surgical masks. There are three levels for medical masks: level 3 to level 1. Level 3 is the highest, so it has a higher water resistance ability, and it can filter 98% of bacteria and the virus. Same as level 2, it can filter 98%. And the level 1 is most common, like the one I use. So level 1, the colored side is for facing out. It's water resistant. Level 1 has a little bit lower water resistant ability, but it can still work enough. And it filters 95% of bacteria and viruses. The reason why we don't need a level 3 is for general public, we are not working or contact the really serious ill patients. So we have very little chance to be hit by the really big droplets, right? So we don't need the high level of water resistance. And usually the virus concentration around us is low, and after filters, even though it's just 95%, I think it can still protect us. So for general population, general public, like the old elderly people, and for people go out for grocery and for indoor activity, and also for the sick people isolation at home, you can just use level 1 because it's the most affordable and available mask, and it's easier to buy. For higher level, it's very hard to buy and more expensive. And according to my colleagues and schoolmates in China, according to their experience, in China they just use N95 for professionals in the hospital and the level 1 medical masks for the general public, and it works. So that's the topic for today, and every family should stock some masks just in case you go out or someone is sick at home, you need the mask, and it's just a one-time use, you cannot reuse it. So stay home, stay away from other people, perform good hand hygiene, and take rest, eat nutritious food, and take care of yourself and your family. Thank you.